Assalamu alaikum dear students. Today we will discuss Hematology MCQs part 5th. Which one of the following is a feature of chronic extravascular hemolytic anemia? Option A. Raised serum coagulated bilirubin. B. Low reticulocyte count. Option C. Hypocellular bone marrow. And option D. Gallstone. So the correct option is D. Gallstone. Explanation is chronic extravascular hemolysis leads to pigment. For example, bilirubin, which is the feature of chronic extravascular hemolysis due to gallstone. Spherocytes in the blood film are a feature of which one of the following? Option A. Thalassemia major. B. Autoimmune hemolytic anemia. C. Reticulocytosis. And option D. dy6kj. So the correct option is B. Autoimmune hemolytic anemia. Spherocytes result from antibody-mediated red blood cells membrane loss. For example, AHA, autoimmune hemolytic anemia. Subscribe now and press the bell icon. Never miss an update from a technologist. In the blood circulatory system, some dash possess values to prevent backflow to the blood. Option A. Veins. B. Arteries. C. Both. And option D. None of the above. So the correct option is A. Veins. Veins, especially in the lower limbs, they have valves, but arteries do not have valves. So this is very important MCQs. Which one of these statement is not true concerning erythropoietin? Option A. 90% of the hormone is made in the liver. B. It contains a hypoxia response gene. Option C. One stimulus to production is a low atmospheric oxygen level. And option D. Levels in the blood are high if a tumor secreting erythropoietin is causing polycythemia. So the correct option is A. 90% of hormone is made in the liver. So explanation is tumor secretes APO, erythropoietin, high level, while renal disease polycythemia vera have low EPO. So this is very important MCQs. The pH of blood is dash. Option A 7.0 to 7.2, B 7.35 to 7.45, option C 7.1 to 7.8, and option D 7.0 to 7.8.0. So the correct option is B 7.35 to 7.45. So explanation is the pH of the human blood is tightly regulated and slightly alkaline, normally range between 7.35 and 7.45. So this is very important MCQs. Which of the following anemia is due to reduced production of red blood cells? Option A. Disseminated intravascular hemolytic anemia. B. Sickle cell anemia. C. Blood loss. And option D. Anemia of renal failure. So the correct option is D. Anemia of renal failure. Renal failure reduces EPO, erythropoietin, which decreasing red blood cells production. In RBC's morphology in isocytosis refer to dash. Option A. Variation in size and shape of red blood cells. B. Variation in size of red blood cells. Option C. Variation in shape of red blood cells. And option D. Normal and abnormal shape. So the correct option is B. Variation in size of red blood cells. Explanation is in isocytosis is a variation of size of red blood cells, while poikilocytosis is a variation of in shape size. What is the most common type of hypochromic macrocytic anemia? Option A, sideroblastic anemia. B, anemia of chronic disorder. C, thalassemia. And option D, iron deficiency anemia. So the correct option is D, iron deficiency anemia. So iron deficiency causes microcytic hypochromic, not macrocytic anemia. This is very important MCQs. What is the major metabolically available storage form of iron in the body? Option A, hemosiderin. B, ferritin. C, transferrin. And option D, hemoglobin. So the correct option is B, ferritin. Ferritin is a soluble available storage form. Hemosiderin is insoluble. Subscribe now and press the bell icon. Never miss an update from my technologist. Dear students, this is very important MCQs. Which one of these is not a feature of blood count and bone marrow in patient with aplastic anemia? Option A, abnormal blast cells on the blood film. B, normal appearance of neutrophils on the blood film. C, normochromic normocytic anemia. So the correct option is A, abnormal blast cells on the blood film. Explanation is blast suggest leukemia. Aplastic anemia shows hypocellular marrow without blast. Which one of the following is not a tissue macrophage? Option A, Kupffer cells. B, microglial cells. C, mast cells. And option D, nerve cells. So the correct option is C, mast cells. Mast cells are granulocytes, not macrophages. So this is very important MCQs. The least mature precursor in granulopyosis is the option A, promyelocytes. B, myeloblast. C, myelocytes. And option D, metamyelocytes. So the correct option is B, myeloblast. So this is the order of mature precursor in granulopyosis, which is myeloblast, 2 promyelocyte, and 2 myelocyte, and then metamyelocyte. Dear students, this is very important MCQs. The number of segments in the neutrophils increases with the age of the cells, and dash percent have 3 segments. Option A, 10 to 30. B, 30 to 40. C, 40 to 50. And option D, none of the above. So the correct option is C, 40 to 50. So mature neutrophil typically have 3 segments, which is 40 to 50%. T lymphocytes contribute about dash percent to the total lymphocytes. Option A, 20, B, 40, C, 60, and option D, 80. So the correct option is D, for 80. T cells are 70 to 80% of circulating lymphocytes. In sickle cell anemia, ESR value will be option A, increases. B, decreases. C, remains constant. And option D, none of the above. So the correct option is B, decreases. Sickle RBCs cannot form Rolex formation because of lowering ESR value. If you like this video, please सब्सक्राइब माय यूट्यूब चैनल। अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे यूट्यूब चैनल को सब्सक्राइब ज़रूर करें. So, which one of the following ESR tubes is open at both ends? Option A, Western green tube, B, Wintrobe's tube, C, both A and B, and option D, none of the above. So the correct option is A, Western green tube. Western green tube is open at both ends. Wintrobe is closed. The normal hemostatic response to vascular damage depends on three major factors. Which one of the following is not included in that group? Option A, blood vessels wall, B, stasis of blood flow, C, circulating platelets, and option D, blood coagulation factors. So the correct option is B, stasis of blood flow. Thank you for watching my videos.